Guys, today I'm going to be presenting to you about Graves' disease. So what exactly is Graves' disease? Well, essentially it's just an autoimmune disorder that targets the thyroid gland of your endocrine system. So as you can see over here, it's just a butterfly-shaped gland that's located in front of your neck. It produces hormones like T3 and T4 that are responsible for controlling metabolism, and because it affects how your body processes that food that you intake into energy for different organs in your body, you see that there's this body-wide effect of Graves' disease. So when you have this, it just means that your thyroid goes into overactive mode. It works overtime. And you see a lot of the symptoms that people with hyperthyroidism have. So what exactly is the cause of Graves' disease? Well, kind of like what I was explaining earlier, when your body is functioning fully normally with no thyroid or hyperthyroidism or any kind of endocrine disorder, your anterior pituitary gland located in your brain releases this hormone called the thyroid stimulating hormone, which, exactly like its name suggests, stimulates the thyroid to produce the T3 and T4 hormones. And these are known as thyroid hormones. But when you have Graves' disease or hyperthyroidism, instead of TSH being produced by the pituitary, your body actually produces abnormal antibodies that mirror TSH and take its place in stimulating the thyroid. But instead of producing normal amounts of T3 and T4, you see that there is an overproduction of those thyroid hormones, which causes those symptoms of characteristic of hyperthyroidism. And these antibodies, they're called the thyrotropin receptor antibodies, or TRAB. And the thyroid stimulating immunoglobulins, TSI. There isn't exactly a well-known cause or mechanism for Graves' disease. Researchers are still looking into it. They just know that these abnormal antibodies are being produced, and that's what's causing the thyroid hormone to go crazy. But they have found that there are several possible risk factors that can lead to the development of Graves' disease. For example, you see that there's any kind of variation in your HLA complex or your human leukocyte antigen complex can cause the production of those antibodies. Other examples include changes in sex hormones for women. Women are actually about 7 to 8 times more likely to develop GD than men. Even viral or bacterial infections can further induce GD. And if you're a smoker with GD, then you're more prone to developing GO, which is really just the manifestation of this disease in your eyes. It causes this bulging of the eyeballs. It's a rare but highly characteristic hallmark of the disease. So what exactly are the symptoms of GD? Well, first and foremost, patients who are diagnosed with GD often have exophthalmos, or that bulging of the eyes that I was talking about, though only 1/3 of the patients develop this symptom. Even less or even fewer patients actually have severe eye problems or trouble with their vision. But it is an extremely common hallmark of GD. Goiter actually is also another one. And that's really just when you see that enlargement of the thyroid gland. You can see just this lump sticking out in your neck, and when you see that in someone, the first thing you think of is probably hyperthyroidism or GD, something along those lines. You also see that patients have high levels of anxiety. So if you're someone with GD, you're probably nervous all the time, irritable, feeling restless. You have these like hand tremors, you're shaking, you're feeling tired, lethargic, weak, your muscles are aching, you don't really feel like moving around a lot. And that's because your body is going into overdrive. Your thyroid hormone is extremely your thyroid gland is extremely active, releasing those thyroid hormones, and it's just going all over your body, and all your organ systems are affected. You're just feeling weak overall. Of course, your excretory system is also affected. You see patients with frequent increased bowel movements or diarrhea. They also have an extremely high heat intolerance, so high sensitivity to heat. They're feeling sweaty all the time. And also because, your body is using up so much energy producing these hormones, and all of these organs are working so actively. You see this unexpected but severe and drastic weight loss. Oh, and also sometimes women experience disruptions in their menstrual cycle because of those changes in sex hormones. Men actually can develop erectile dysfunction, and there may also be a lowered sex drive. All of this is just part of GD. These are all like symptoms characteristic of hyperthyroidism, but GD, because it is really just an extremely strong manifestation of hyperthyroidism, also includes all of these symptoms. More specifically, though, I would focus on exophthalmos and goiter as like the characteristic symptoms of just GD alone, as opposed to hyperthyroidism. Also, you see that some patients do develop Graves' dermopathy, or the protrusion of these, I guess like the formation of these reddish lumps on their shin. You see that there's just really skin lesions. They're not painful or anything, but they are present and evident, and this is known as Graves' dermopathy. So there's Graves' disease, and then an advancement of the disease or further development of either symptoms of the eye or symptoms of the skin are known as Graves' ophthalmopathy or Graves' dermopathy, respectively. So what kind of tests are being done to diagnose GD? Well, for starters, physicians usually have patients undergo a blood test to check for levels of TSH. And if they have lower levels or suppressed levels of TSH, that means that they probably have GD. And then there's also, lab tests that they have to undergo to check for the presence and levels of those abnormal antibodies that I was talking about, TRAB and TSI. If they don't have those antibodies, well, then there's a high chance that the symptoms of hyperthyroidism that the patient is showing is due to some other thyroid-related condition or disorder. Then there's also the radioactive iodine uptake test, in which small doses of iodine are injected into the body, and they measure how much iodine is being taken up by the thyroid gland. So once again, iodine is what the thyroid gland uses to produce those T3 and T4 thyroid hormones. So if high levels of that iodine, radioactive iodine, is being taken up by the gland, then that just means that it's being overworked, and it's going into an extremely active mode to overproduce those T3 and T4 hormones. There's also the thyroid scan, which really just measures how, or not how much iodine is being taken up, but where exactly that iodine is going within the gland. If it's going all over the gland, if all of the thyroid gland is using up the iodine, then the patient probably does have GD. If not, there are other causes that may contribute to those symptoms of hyperthyroidism. So really, there are only 3 different types of treatment for GD. doctors, they could choose the easiest route and prescribe anti-thyroid drugs, which would just cause the thyroid gland to produce less of the thyroid hormones and release less of them into the bloodstream. But this usually takes from somewhere between weeks to months to kick in. So the other medication that doctors prescribe are usually beta blockers, which offer more quick and immediate relief of those irritating symptoms of hyperthyroidism, like rapid heartbeat, nervousness, irritability, muscle weakness, that kind of thing. Then there's also radioactive iodine therapy, in which patients orally intake iodine either through tablet or liquid form in order for that iodine to travel via the bloodstream and kill some of those thyroid hormone producing cells of that thyroid gland. This can actually cause the patient to have hypothyroidism, so they kind of go from having hyper to hypo. While both are bad, hypothyroidism is by far the less detrimental condition to have, and that's probably why doctors often choose that form of treatment. Very rarely, they also perform surgery to just completely remove the thyroid gland from the body. This can also cause some of the symptoms of hypothyroidism, even though the gland isn't there anymore, because there essentially is no thyroid hormone being produced at all by the body. It can cause those symptoms. Usually, I think doctors just have patients take pills of those hormones as compensation. Of course, failure to treat this disease can cause severe health problems. So there can be irregular heartbeats, stroke, blood clots, a lot of cardiovascular problems going on there. In terms of eye health, well, like I was saying earlier, there can be development of GO, where they have double vision or loss of sensitivity in the eye, or eye pain. Very rarely, but it is possible for those patients to also develop just complete loss of vision. And there's, thinning of the bones or osteoporosis, weak and brittle bones. All kinds of problems can happen if GD isn't diagnosed and treated early on, which is why it's very essential to just go get checked out by the doctor if you're experiencing any of those symptoms that I mentioned earlier of hyperthyroidism and, by extension, Graves' disease. And these are just my references. Thank you for listening.